Cataracts is something that millions of Americans deal with each and every day, and if it's left untreated, there can be serious health effects. But early detection is key. I'm with Dr. Shaw. You are with Bennet and Bloom Eye Care Centers. Thank you so much for being here today.
Thank you for having me.
So for those who really don't know exactly what are cataracts and how do they really affect someone's vision?
Great question. So a cataract is a natural clouding of the lens of the eye. So everyone is born with a lens in the eye, most people, and that lens is typically clear at birth. And as we get older, that lens tends to get cloudy over time. That tends to happen more after the age of 40, 50, 60, kind of towards the later years. And what patients can experience is blurry vision, glare, nighttime difficulty with driving, halos, starbursts, and overall just poor quality vision as they continue to get older. And one of the telltale signs that my patients tell me is that they'll go to the eye doctor, they'll get new glasses, and then about a couple months later, those glasses just don't quite work for them anymore. So they go back, they get another pair, and those just don't quite work. So that's another kind of sign that your cataracts are probably growing, they're probably progressing, and those are just some of the signs to look for.
Yeah, and what are some of the risk factors or causes of cataracts?
So the main cause is age. So if you have enough birthdays, you will develop cataracts. So it's not necessarily a bad thing. There are some systemic diseases that can accelerate the progression of cataracts. The most common one being diabetes. So the fluctuation in blood sugar that some people will get with diabetes will accelerate the formation of their cataracts. There's obviously different systemic conditions that can do that, but that's the most common. And then there's medications that can accelerate cataract formation as well. The most common being steroid use. So people who have chronic inflammatory conditions, autoimmune diseases, asthma, things like that, who are on steroids for a long time, they'll notice that their cataracts might get a little bit worse, a little bit faster than the average person.
Okay, so you mentioned that sometimes if that prescription, every couple of months, maybe even every year, you're getting checked for that. So is that someone who should really consider surgery?
I think so. Again, we do cataract surgery on patients when their cataracts are affecting them. So if someone were to come into my office and say, doc, my vision's fine, I can do everything that I want to do, my driving's fine, I feel safe, I'm good. I say, great, we wait a little bit. But if they're starting to notice these issues, they're not able to do the things that they want to do all the time, then it's reasonable to consider moving forward with cataract surgery.
So how does someone prepare for that surgery?
Great question. So the initial consultation is going to be very important. So the person will make an appointment, come see an eye doctor. And what we do at that visit is we do measurements of the eye, photos of the eye, we do a full eye exam, and then we talk to the patient. So we tell them, this is what we see, this is how your eyes look, this is the overall health of your eyes, and then we talk about options as far as cataract surgery. So we'll go through all of that with the patient when they come in. We'll talk about what they can expect during surgery, what they can expect afterwards, recovery, etc. So that's kind of the before care. As far as during the surgery, this is what most people want to know.
Yes.
The surgery itself, I promise, is not bad. It takes less than 10 minutes. And what everybody wants to know, you are sedated during this surgery. So you will get an IV, you will have anesthesia, you'll feel comfortable, you'll feel great. Most people don't really remember the surgery, maybe little bits and pieces, but the most common thing I hear is, that's it, you're done, that's it. And they're very, very happy afterwards. So pretty straightforward and pretty relatively simple, safe surgery.
All right, that is good to know. Yeah. There's been so many advancements to further, educate your patients and really make them feel comfortable about the surgery, because I know that could be so scary for people.
Yes, exactly. So the great part about cataract surgery is I like to think of it as an opportunity. So a lot of people think, oh gosh, I have to have cataract surgery, this is horrible. It's not. It's actually awesome, because this is an opportunity to get the vision that you've always wanted. And so I like to look at it that way. So there have been so many advances as far as cataract surgery is concerned. There's so many different lens options out there. Your doctor will talk to you about those lens options at your visit. But some of the favorites out there are You can get out of your glasses completely. If you've had glasses your whole life, you can come out of cataract surgery not ever needing glasses anymore. And that's really prevalent with some of our multifocal lenses, some of our customized lenses. If you're someone who loves your glasses, fine, you can wear them afterwards. You can get another pair of bifocals. You can get it so your vision is fine in the distance and you just need reading glasses. And then one of the newer lenses we have, which is great, you can have your cataract surgery done, and then you can have adjustments made in the office afterwards to really customize your vision. So that is a light adjustable lens. So that's kind of some of the newer things that are out there. You can choose to have a laser to assist with your procedure, or you can choose not to. So there's so many different options out there, lots of ways to customize your vision to what you want. And a lot of people tell me, Doc, I haven't seen this well since I was a kid. So it's again, a really great opportunity to get what you want out of your vision.
It can truly be life-changing.
It can be.
So if you're interested in learning more, just go to eyecenters.com.